Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. A little sweetness, be it in personality or in food, doesn't harm anyone, isn't it? But what if this sweetness reaches a level when it starts harming the body itself? High blood sugar damages vital organs without early symptoms. Diabetes, a medical condition, often begins quietly, but if ignored, can turn life-altering. It not only is a disease of glucose, it is a disease of routine, discipline and awareness. Today in Wellness Watch, we discuss diabetes and its prevention. I'm Preeti Kaur. Diabetes is rising at a worrying pace across the world, a condition that often develops quietly but leads to life-changing complications when ignored. As global awareness efforts like World Diabetes Day, observed every year on November 14th, continue to highlight the importance of prevention, early diagnosis and treatment, one question stands out for millions living with the condition: can diabetes be reversed? Here's a report by DD India's Harshada Oberoi. Diabetes occurs when glucose, the body's main energy source, builds up in the bloodstream. Insulin, a hormone made by the pancreas, helps move this sugar into the body's cells. But in diabetes, the body either doesn't produce enough insulin or cannot use it effectively. As a result, glucose stays in the blood instead of being converted into energy. When diabetes is not controlled, sugar levels remain high, a state known as hyperglycemia, which over time can damage nerves, blood vessels, and several vital organs. Symptoms include excessive thirst, frequent urination, tiredness, blurred vision, and slow healing wounds. But many people notice nothing until complications appear. Diabetes appears in several forms. Type 1 diabetes is an autoimmune condition where the body does not produce insulin. It usually affects children and young adults. Type 2 diabetes often develops due to insulin resistance, commonly linked to obesity, inactivity, stress, and diet. Hormonal changes during pregnancy cause gestational diabetes, which needs close monitoring because it affects both mother and the baby. Doctors diagnose diabetes through fasting glucose tests, random blood sugar checks, HbA1c tests, and oral glucose tolerance tests, which measure how the body responds to a sugar load. In a fasting blood glucose test taken after 8 to 9 hours without food, less than 100 milligrams per deciliter is normal. 100 to less than 126 milligrams per deciliter indicates prediabetes, and 126 milligrams per deciliter or more on two tests confirms diabetes. For the A1C test, less than 5.7% is normal. 5.7% to less than 6.5% signals prediabetes, and 6.5% or more confirms diabetes. A random blood sugar reading of 200 milligrams per deciliter or more, along with symptoms, can indicate diabetes. Similarly, a 2-hour oral glucose tolerance test result above 200 milligrams per deciliter also confirms diabetes. Obesity, lack of exercise, high blood pressure, high cholesterol, smoking, and genetics all sharply increase diabetes risk. Uncontrolled diabetes damages blood vessels and nerves, leading to heart disease, kidney failure, infections, vision loss, and even amputations. Treatment includes medications or insulin, balanced meals, regular exercise, and routine monitoring to keep blood sugar in a safe range. While type 1 diabetes cannot be reversed, early type 2 diabetes and prediabetes can often be improved and even brought into remission through weight control, regular physical activity, and diet changes. Early action makes the biggest difference. Prevention rests on healthy eating, staying active, managing weight, reducing stress, and getting regular screenings, especially for those at high risk. Diabetes is not destiny. Early testing and lifestyle changes can stop diabetes before it starts and protect the heart, kidneys, and vision for life. Harshita Oberoi's report, Wellness Watch, TT India. Doctors often call diabetes a slow poison because persistent high blood sugar gradually damages the heart, kidneys, eyes, nerves, and even the feet without showing early warning signs. About 537 million adults across the world have diabetes, and experts predict this number will rise to 643 million by 2030 and 783 million by 2045. World Diabetes Day is observed every year on November 14th to raise global awareness about diabetes and its prevention, diagnosis, and treatment. This year's theme, Diabetes and Well-being, highlights the critical link between physical health, emotional balance, and quality of life for people living with diabetes. Today in Wellness Watch, we look for these answers. What causes diabetes? How does diabetes affect mood and thinking process? How can diabetes be prevented? Can diabetes be cured? And we also discuss the medical advancements in India. Diabetes treatment in India involves a combination of lifestyle modifications, medications, and other medical interventions such as surgery for several severe cases. Treatment plans are customized based on the type and severity of diabetes. Integrated approaches combining modern medicine with traditional therapies like Ayurveda are also available. Up on your screens, we'll have some hospitals and institutes which specially cater to this. All India Institute of Medical Sciences, Delhi, Institute of Diabetes, Kerala, King Edward Memorial Hospital, Mumbai, Safdarjung Hospital, Delhi, Postgraduate Institute of Medical Education and Research, Chandigarh. All right, to help us understand diabetes better and its prevention, we are joined in by guests. We are joined in by Mr. Shashank Joshi. He's endocrinologist, Leelavati Hospital, Mumbai. He's also the president of Indian Academy of Diabetes. He's joining us virtually. And Mr. Sunil Kumar Mishra, director, Diabetes and Endocrinology, Graphic Era Hospital, Dehradun, is joining us here in the studio. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Sunil, to begin with you, I want you to explain to our viewers in simple terms what causes diabetes. Though we've shown a detailed report to our viewers, but help us understand which type is more severe.
The diabetes is caused by insulin deficiency. So, type 1 diabetes, when there is insulin is deficient more than 70–80%, the diabetes is diagnosed, and it is diagnosed in a very short span of time. And they would require insulin throughout their life to maintain the glucose level, as well as for the normal survival, as well as for the long term prevention of the complications. Whereas the type 2 diabetes, so there is a battle of the insulin resistance and the insulin deficiency. The time the pancreas is able to overcome the resistance, so there is no clinical diabetes will be detected, although resistance is there. So, there are many overweight, obese individual who are showing sign of insulin resistance, but they are not diabetic yet, because as the report of the Harshita, they are not fitting into the criteria of the diabetes. But once the pancreas is unable to overcome the insulin resistance, so they became diabetic, and throughout their life the diabetes can persist, except the condition when they are able to lose weight at least by 10 to 15%, they can reverse back. So, the most common reason for the diabetes is the insulin deficiency, because pancreas is getting weaker by the time. And for that there are many factors like change in the lifestyle, increased adiposity or fat, belly fat, physical inactivity, the stress which you have also told about, and the modern lifestyle which we are dealing with nowadays. Thank you.
All right, so that was about diabetes, and I also asked you, sir, which type of diabetes is more severe?
All diabetes are more severe. See, we should not try to categorize diabetes less severe or more severe. At uncontrolled diabetes, in long run, you have already told in the beginning that in long run it is a slow poison. In long run, uncontrolled diabetes will result into the complication, or that means the damage in the various organ in the body. So, type 1 diabetes, if well controlled in first 5 to 10 years, which is known as a golden period of the type 1 diabetes, the long term complication even at 20 year or 30 year will be less. Similarly, the type 2 diabetes, when the very wonderful trial UK PDS trial, which laid the foundation of the diabetes care which we follow still now today, told us that controlling diabetes from very beginning, from the on start of the diagnosis for
Right.
first 10 years result into the less complication. Why diabetes is a serious problem, we should try to understand. Diabetes shorten lifespan of individual by 5 to 7 years. Until unless we take care of the 5 factors, those 5 factors are good sugar control, good blood pressure control, good cholesterol control, smoking avoidance, and if there is kidney protein leakage, we have to manage it. If we do that, we allow people to live normal lifespan.
All right, at this point, I will bring in Dr. Joshi. Dr. Joshi, help us understand, how does diabetes affect mood and thinking process of a person?
See, Harshita ji, you have explained very nicely that when you get the diagnosis of diabetes, people come under stress. And stress also, it's a two-way sword. So, when there is excessive stress, emotionally we eat more, we exercise less, we become sust and must. And that causes a really aggravation of type 2 diabetes. Also remember that the diagnosis of diabetes, everybody attacks you. Your family members, your near and dear ones, they say, don't eat this, do that, do this. Everybody has their own little remedy for diabetes. Diabetes is a serious, silent public health emergency. And when the glucose sticks to your brain, it sticks to your blood vessels, it causes complications. And it's a very, very treatable disease. It can undergo remission. If you don't have type 1 diabetes, which needs insulin for life, but it's the classical garden variety type 2 diabetes, you can actually remit diabetes and take away all the medications and just be on aggressive lifestyle management. If you hit hard, hit early in the first decade, as Dr. Mishra said. Of course, for type 1 diabetes or gestational diabetes or secondary diabetes, you need insulin for life. But that also can be managed efficiently. So I think mind is the window, the brain is the window where we think and we eat. And type 2 diabetes is all about lifestyle. So if we eat too much and become sust and must and become very sedentary, it's all in our mind. And therefore, diabetes people often get distressed, they get depression, they get anxiety, and all that can be handled. And therefore, a mind coach and counseling and empowering them is equally important. This year's theme is well-being. So we want to empower, remove the stigma. People should talk about their diabetes. We should be managing and eat healthy, eat less, eat on time, and then ensure that we do a lot of physical activity. Sitting is the next smoking. So even if we do a 5-minute brisk walk, 8 to 10 times a day, it's as good as doing a regular gym. And doing some yoga, thinking positive, listening to music, doing some, simple things, they make a lot of difference. Also, it's very important to give a lot of hope to people living with diabetes, because diabetes complications are preventable. We want to have a complication-free world, complication-free Bharat by the time
Yes.
India becomes 100. And that is very important. So it's all in our mind. And if we change our mindset and are positive, cheerful, and they get a good medical doctor supervising this entire process, I think we can manage diabetes better. And we need happiness, because we should not create distress.
Yes.
Diabetes is not a negative disease. It's a disease which can be managed efficiently under medical supervision.
All right, so hit hard and early is the crux. Dr. Sunil, help us understand, is diabetes genetic? Is there a particular age group that is more prone to diabetes? Added to that, help us also understand, how do children get affected by diabetes?
So, genetics does play a large role in diabetes, so no question about that. But the way the diabetes has increased, it has increased phenomenally. So, that cannot be explained by genetics. So, for a genetic pool to double up, it takes around 50 years. But the way the diabetes has doubled and tripled in just couple of decades, it cannot be just based on the genetics. We Asians are always at a high risk of diabetes, being the more fatty people, less muscle mass, increased belly fat, physical activity is less, and the diet is rich in carbohydrate. All these factors put together put us at a higher risk of developing diabetes early on. So, genetics is yes, prediction is for everyone, predilection is for everyone, but the people who are overweight, obese, physically inactive, if their parents are also diabetes, they are at increased risk of developing diabetes. Now, coming to the children. So, earlier on, say if I take you 2-3 decades back, so most of the people who used to get diabetes below 30 years, they were classified primarily as type 1 diabetes, but that is not a case nowadays. There are many children below the age of 30 years even are being diagnosed with a type 2 diabetes. Now, type 2 diabetes at early age is a very, very aggressive disease. because they do develop type 2 diabetes at early age because of the both phenomena, insulin deficiency as well as the insulin resistance. And type 2 diabetes is not a single disease of the insulin deficiency. There are multiple inflammatory or markers in the body. The other organs are getting involved much early on. So, by the time they reach say 30-35 years, 50-60% of them already develop complications if they are unable to maintain
When
the
we
sugar
talk
level.
of diabetes in children, is it just about eating habits? Any word of caution or any advices you would like to give to the mothers through this forum so that they can, be careful when they're offering food to the children?
Of course, yes. See, everyone whosoever is having diabetes or not having diabetes should definitely include a healthy food habits, minimizing the carbohydrate, coarse grains, mota anaj, more adequate amount of the protein, fibers and fruits to be there, and most importantly all parents should maintain the weight of the child in the normal reference range. They should plot the weight in the Indian reference centiles, and if the child is gaining weight, definitely they should take action, and the first action can be taken at home. Family is the smallest unit of the society. Any change at the family level will definitely reflect into the society.
All right. At this point, I'll bring in Dr. Shashank. Dr. Shashank, help us. And that was about preventing, and that was about being careful about diabetes. But then, when we talk of diabetes diagnosis, how is it done? How many times in a day, or how frequently should a person measure his level of glucose?
So first thing is that in diabetes, we need to monitor blood glucose. And the main tests which we do are once in 3 months. So we do a 3-month average sugar called glycosylated hemoglobin, which has to be done once in 3 months with kidney test and lipid test and fundamental blood tests which have to be done once in 3 months. But to check the fasting and post-lunch blood sugar, we can use a sugar testing machine. Sometimes we can use a patch for measuring sugars. People who use insulin, this is very useful. Also, these patches and sugar testing machines allow us what foods will increase our sugars, what foods will decrease our sugars. When you do too much of exercise, if you skip a meal, what will happen? So it allows us to handle emergencies better. So monitoring of sugar can be done daily for people who take insulin. For people who don't take insulin, they are supervised by diet and exercise. They can measure their glucose every week or every 2 weeks. But the 3 months is the gap in which they should do fundamental blood tests and see their doctor every 3 months. That is what we recommend. People living with type 1 diabetes who have to take insulin for life, or a woman who has got a pregnancy and is going to deliver in some time, they need to check their sugars at least 4 times a day with a sugar checking machine and manage their sugars with diet, exercise, insulin and or medications under medical supervision or a coach. And all this comes as this thing. Once a year, we recommend all people living with diabetes should get their eye checked and heart checked, because we know that sugar sticks to the eyes and we need our retina to be checked. Also, we know that sugar can cause heart issues, so that also has to be checked. So these are the fundamental parameters under which we need to do that, and this can be very easily done. And seeing a doctor is equally important. Many a times our patient think that मेरा sugar ठीक हो गया, अभी मेरा diabetes ठीक हो गया, मेरे को ना दवाई की जरूरत है ना डॉक्टर की जरूरत है. दवाई और डॉक्टर दोनों की जरूरत है, but it needs medical supervision.
All right. Why do people with diabetes, why do they have to take special care of their wounds? Dr. Shashank.
Wounds don't heal. When the sugar levels go up, then we know that the wound healing process is delayed and deferred. And therefore, glucose control being good is equally important for good wound care. And therefore, that has to be on the spotlight. Secondly, we numb our nerves. We get neuropathy. So the nerves do not feel the pain. So it is painless. Many people, when they walk bare feet, they just don't know that their feet are affected with a wound, and they keep on getting micro injuries, and ultimately that leads to large wounds and that leads to amputation. That all can be prevented. So we want to have an amputation-free world for people living with diabetes, and therefore testing the nerve health, testing the sugar is equally important in people living with diabetes.
All right, Dr. Sunil, when we talk of managing diabetes better, you did talk of a healthy lifestyle. But specifically when we talk of genetic diabetes, can losing weight for a person be beneficial if, if diabetes runs in the family?
Of course, always. Losing weight will help person enormously in terms of the diabetes control as well as the occurrence of the complication because of the diabetes. Because in diabetes, it is not only the sugar. That is what Dr. Shashank was also talking about, and you also talked in the beginning. It is the blood pressure, it is the cholesterol, and it is inflammatory ground which result into the heart problem. So, weight is again one factor which will definitely result into the aggravation of those complications. So, if a person, now there are two windows of the opportunity. If there is a strong family history of diabetes, but that family history cannot be changed, that is a non-modifiable risk factor. But by losing weight, what we can do, that we can delay, the person can delay the diabetes. Many times people ask, Dr. Saab, मेरे father को diabetes है, my mother is also having diabetes, what can I do? Maintain ideal body weight, live healthy life. Then people who develop diabetes, so there is a window of opportunity that all of us has talked about, is that the remission is possible in people with type 2 diabetes when they lose weight 10 to 15% of the weight, and in early phase of the life. So, that helps in the remission of diabetes as well as decreasing the diabetes related complication. Weight loss will result into the sugar control, weight loss will result into the blood pressure control, weight loss will result into the cholesterol level modification. Fatty liver also, the progression of the fatty liver towards the fibrosis and cirrhosis will also decrease. So, very, very important point you raised regarding the weight.
Yes, so prevention is always better than cure. At this point, I will bring in Dr. Shashank. Dr. Shashank, when we talk of diabetes, then you know, both of you have explained to us in detail about how diabetes can be dealt with, what prevention can be taken. But when we talk of managing diabetes, or for that matter, when we talk of curing diabetes, then to what extent do home remedies help in this? Or for that matter, are there any kitchen ingredients in our homes that can be beneficial, that can prove to be beneficial for diabetic patients?
So I think it's important to recognize that people who have early type 2 diabetes, a lot of home remedies are useful and important. You know, all the bitters are useful. Avoidance of sweet, sugars, carbohydrate, fats, they are going to be useful. And therefore, whether it is a cinnamon or a fenugreek or a amla or many other ingredients which are natural phytochemicals have some adjuvant role in management of type 2 diabetes. But that's only in the first decade of a diabetic's life, which is type 2 diabetes. But that may not be possible for a type 1 diabetic who needs insulin for life. So remember, when it is type 1 diabetes, gestational diabetes or secondary diabetes, they need insulin for life. But when it is a lifestyle disease, which is type 2 diabetes, in their early phases, a lot of remedies are useful. And one of the important remedies is discipline, because at home, we were always taught discipline. And with that discipline, a lot of these phytochemicals which are there, simple things like fenugreek, simple things like cinnamon, simple things like cutting out the sugars, the carbs, the fats, the fried food, and being physically active are equally important when we are managing. So they are very good lifestyle adjuvant tools which are useful, and they are all our ancient tools. For example, doing a simple Surya Namaskar.
Yes.
It is a very holistic exercise. Kapalbhati. You know, they are very useful for type 2 diabetes as adjuvants under medical supervision. So I say that yes, lot of our ancient wisdom is useful. Remember, Sushruta and Charak Samhita had described Madhumeha a long time back, centuries back. But the lifestyle was the key. So what is good from our Prachin Parampara or ancient wisdom or tradition is that lifestyle is a very good adjuvant, but you still need the medical supervision for tablets and insulin. And in type 2 diabetes, we can mitigate a lot of that.
All right. Dr. Sunil, what are the medical advancements with regard to this in India?
So, there have been many. So, over the time in last, I would say in 2 decades, we have changed a phenomenal development in people with type 2 diabetes. So, we can change the natural history of the diabetes and its complications. So, most important part about any chronic illness, so how can we intervene in the natural history of the disease? Natural history means how the disease is going to behave in next 1, 2, 3 decades or in the life of the person. So, if you can change the natural history, so as we have already talked about, if we lose weight, if people lose weight, they can go into remission. But once they have already diabetes, controlling diabetes can be easy because we have many drugs which doesn't cause low sugar and also help in losing weight. Like people taking GLP receptor agonists, those group of the injectable drug will help people losing weight. Then there are drugs which can cause leakage of the glucose from kidney and protect the kidney in term in long run and protect the heart in long run. So, people who have already diabetes, but there are some complications like in the heart, like in the kidney. So, those can be prevented for further progression, and the progression of the complication can be slowed down. So, that help in them living normal life. Then there are of course vaccination for the people with the diabetes to minimize the infectious disease.
Right.
People with the liver disease, if we help them in losing weight, and newer group of the GLP
Yes.
receptor agonists has also helped them in decreasing the progression towards the chronic
All
liver
right,
disease.
so that was
Yeah.
about the medical advancements that have been made in this field. We'll have a quick rapid fire round. I'll ask you questions and I request both of you to give very crisp answers. Dr. Shashank, people with diabetes cannot have sweets. Is it so?
That's not true. They can have a little bit of everything. They should taste and share, and they should eat less, eat slowly, and eat on time. So it's very important that it's not that everything is banned, but have everything in moderation and do it under medical supervision.
Fruits are unhealthy because they contain sugar. Dr. Sunil.
No. Fruits contain fructose and many other vitamins and other micronutrients which are very, very useful for the body. Taking in a small amount, given amount does help, and fruits are one of the best snacks if taken in between meal.
Diabetes can be cured with natural or herbal remedies. Dr. Shashank.
No, I think type 1 diabetes needs insulin for life. Type 2 diabetes can be, they can be at best add-on therapies, but that is not a cure.
If sugar levels are under control, checkups can be discontinued. Dr. Sunil.
Absolutely wrong. We need to help people to get checked for the complications, because that's the most important thing. Being an asymptomatic disease, people feel nothing is happening, but once they land up with the complication, that's the problem. So checkup is should be
Continuous
regular.
checkup, yes.
Yeah.
Kids can outgrow diabetes. Dr. Shashank.
No, they can't. They need to live it with life. But if you are a type 2 diabetic and if you lose weight, you can reverse diabetes as a child, but type 1 diabetes needs insulin for life.
If on insulin injections, one can eat whatever he wants. Dr. Sunil.
No, they can eat healthy food, but discipline has to be there. Carbohydrate, protein and fat should be given amount. So discipline is the must, which Dr. Shashank also talked about.
All right. Thank you so much, both of you, for joining us on Wellness Watch with that information and those insightful revelations. And that did help a lot to our viewers in helping understand diabetes and its prevention. So sugar may tempt you, but your health deserves the final say. A simple sugar check, mindful eating and a 30-minute walk. With discipline, checkups and balanced habits, every step today towards will become a step towards a healthier tomorrow. Diabetes is not the end of the journey. It is the beginning of a smarter living. With that, we end this edition of Wellness Watch. Thanks for watching. Bye-bye.